You're running, barefoot, across hard ground, in the dark. Something tore your calf open 2 days ago. A branch, a rock, a bad fall, and the wound is already hot to the touch. No antibiotics, no antiseptic, no urgent care 3 miles down the road. The infection is either going to kill you or it isn't, and nothing in the world you live in can promise you which way it goes. That's not a nightmare scenario. For the first 300,000 years of human existence, that was Tuesday. Right now, a round of antibiotics costs less than a fast food meal. A surgeon can remove an infected appendix before it ruptures, stitch everything back up, and send you home the same week. That is so normal it has stopped seeming remarkable. But strip all of that away. Every pill, every procedure, every sterile bandage, and you're left with the only honest question: how did any of us survive long enough to be here? So how did ancient humans deal with illness, injury, and infection without a single piece of modern medicine? The answer is stranger, more sophisticated, and more human than most people expect. The first place to look is the skeleton. Bones don't lie. In 2010, researchers excavating the site of Shanidar Cave in northern Iraq re-examined a set of remains known as Shanidar 1, a Neanderthal male discovered there in the late 1950s by archaeologist Ralph Selecki. What the bones revealed was extraordinary. This individual had survived to an estimated age of 40 to 50 years. Ancient by the standards of his era, despite a crushing catalog of injuries: a withered right arm that had been amputated or lost at the elbow, severe damage to the left leg, probable blindness in one eye, and evidence of a healed head wound. He was, by any modern assessment, profoundly disabled. He could not have hunted. He could not have traveled easily. He survived anyway. Some researchers interpret this as direct evidence of sustained intentional care, meaning that at least 60,000 years ago, someone fed him, sheltered him, and kept him alive through years of dependence. The biology proves the care existed. It doesn't name the caregivers. It doesn't need to. This is the first answer to the big question, and it's one most people skip past. Ancient humans survived partly because they looked after each other with a consistency that required real knowledge, real commitment, and real time, not sentiment. Strategy, but here's where it gets strange. Everyone assumes ancient humans were passive victims of infection, that they suffered, bled, and hoped for the best. The archaeological and ethnobotanical record tells a different story. Plant-based medicine is not a primitive placeholder for real medicine. It is real medicine. In 1960, anthropologist Shirin Kandahari found pollen samples buried with Neanderthal remains at Shanidar Cave from at least 8 plant species, several of which, including ephedra, yarrow, and groundsel, are known to carry pharmacological properties still studied today. Yarrow, known scientifically as Achillea millefolium, contains compounds with demonstrated antimicrobial and anti-inflammatory effects. Ephedra contains ephedrine, a bronchodilator used in modern medicine until as recently as the early 2000s. These weren't weeds someone grabbed at random. The composition is too specific. The debate among researchers is whether the pollen was intentionally placed or carried in by burrowing rodents. But the plants themselves, and their properties, are not in dispute. Across dozens of ethnobotanical surveys conducted in the 20th and 21st centuries, indigenous communities on 6 continents independently developed uses for plants from the same biological families to treat the same categories of illness, fever, wound infection, gastrointestinal pain, inflammation, not the same plants, the same categories of chemical effect, arrived at by observation alone, across thousands of years of separation. That pattern of convergence is not coincidence. It is empirical science conducted without laboratories. Here's where the real numbers start mattering. The human immune system is not a passive bystander. A healthy immune response can clear the majority of bacterial infections without pharmaceutical intervention. That's not an argument against medicine. It's basic immunology. The question for ancient humans was how to give the immune system the conditions it needed to do that work. In 2012, anthropologist Ian Gilligan at the University of Sydney published research on prehistoric clothing and its relationship to thermoregulation, estimating that early modern humans in Europe were manufacturing tailored cold weather garments as far back as 500 years ago, based on the evidence for needles and scrapers at sites across the continent. The relevance isn't fashion. Core body temperature regulation is directly tied to immune function. A body that is chronically cold fights infection at a disadvantage. The fact that ancient humans developed sophisticated tailored clothing, not just draped hides, but fitted garments sewn with bone needles as fine as 7 millimeters in diameter, suggests they understood, at a practical level, that keeping the body warm was part of keeping it alive. Food was the other lever. Hunter-gatherer diets, studied across living populations by researchers including including Lauren Cordain at Colorado State University, in work published in 2002 in the American Journal of Clinical Nutrition, show dramatically higher dietary diversity than modern Western diets, often 100 to 200 distinct plant species consumed across a year, compared to fewer than 20 in a typical modern diet. Many of those plants contain compounds that support immune regulation, reduce systemic inflammation, and support gut microbiome diversity. They weren't eating medicine. The medicine was in the food, because the food was the whole ecosystem, not a fraction of it. So what were they actually doing when things went wrong? Wound care. This is the domain where the evidence is most concrete and most surprising. Ancient humans managed traumatic wounds with a toolkit that is more sophisticated than it sounds when described plainly. Archaeological evidence from multiple Paleolithic sites shows the use of tree resin as a wound sealant, birch tar in particular. Documented at sites in Germany and Italy, including Niggsau and Campitello, has demonstrated antimicrobial properties in laboratory testing. Researchers including Johann Kohler at the Bavarian State Collection of Anthropology, publishing analysis in 2001, identified birch tar residue on stone tools, and subsequent studies have confirmed that birch bark tar inhibits bacterial growth in controlled conditions. They were sealing wounds with a substance that actually worked, not by luck, by accumulated observation over generations. Wound packing with specific plant materials, mosses in particular, appears in the ethnographic record across multiple continents. Sphagnum moss, used by multiple indigenous groups in North America and Europe to dress wounds, has a pH of approximately 4, which is bacteriostatic. It also absorbs roughly 20 times its dry weight in fluid. This is not folk superstition. This is functional trauma medicine that field medics in World War I used when cotton dressings ran out. Because it worked, and they knew it. But there's a problem with the way this story is usually told. Everyone assumes that ancient life was defined by early death, that a lifespan of 35 years meant ancient humans were dying of old age at 35. That number is one of the most durable misunderstandings in all of popular science. The average life expectancy in pre-modern populations was low primarily because infant and child mortality was catastrophic. A child who made it to age 15 in a hunter-gatherer band had a reasonable chance of reaching 60 or beyond. Skeletal analysis of adult remains from Paleolithic sites across Europe consistently shows individuals with healed fractures, regrown bone around old injuries, and wear patterns consistent with survival into late middle age. They weren't all dying young. Many of them were living long, hard, and surprisingly well, carrying the scars of injuries that healed correctly, infections that resolved, and bodies that were pushed to their limits and came back. The real mortality threats were childbirth, early childhood illness, and acute traumatic injury.